Hi there, thanks for joining us here today. Today I have Monica with us here with our office here. My name is Dr. Roger Sdao, and we're going to be talking a little bit about our new service that we've just incorporated at the office with our food sensitivity testing. And Monica here was one of our patients who took it, and she was gracious enough to come on in and explain some of her results. So I just wanted to first ask you, Monica, so why did you want to take the test? What was some of your reasonings?
Well, basically, I could go through your little checklist of everything that could possibly be contributed to from a food sensitivity.
Sure.
And I pretty much word for word matched almost every one of them. So that was something to consider. And then I had been sick with like sinus infections for years.
And that was my next question. So what were you experiencing ahead of time? So you had a lot of sinus infections?
That was probably the worst. Like I said, there were other symptoms that I'd had, like the ADD or some of the other symptoms that I had, the swelling and the bloating that I had had as well. But for the most part, the sinus had been horrible. And the last several years it had gotten bad enough I had talked to my family about possibly moving. I didn't know what to do. I had been at the doctor 5, 6, 7 times per year, multiple rounds of antibiotics and steroids, and this was all while I was taking at least 5 medications for asthma and allergies daily.
So from the test, what if you can share with us some of the foods that came up positive from the actual food sensitivity test?
For me, it was actually just 2 major categories. It was all eggs. I can't do whites or yolks, and all forms of dairy.
Gotcha. So since then, and you've been incorporating this for a number of months now, if I remember correctly. I don't know exactly how much, but
I started January 1st.
And explain some of the experiences that you've had since then, and taking those out. Anything that came up from that?
Yes, actually, it was really hard at first. It is a sacrifice. Trying to switch your entire
it's a lifestyle
diet,
change.
Very much so. So I am going to preface it with that. But once I got going on it, I felt so much better within 2-3 weeks. I could just notice a difference. January and February are always some of the months I'm always at the doctor with sinus issues. This was the first year I didn't have to go. By March, they had called me to remind me to come in for a med checkup because
kind of an APB out on you.
Yes, because I hadn't been there. This was the longest that I have not been on antibiotics in years. So I actually went for my physical, and at the time I had went, it had been like 4.5 months since I had been there the last time. I had lost more than 10 pounds without trying.
Oh, good.
No modifications to the diet except for that. All my labs were normal, in range, and in fact so in range that he told me I had found the fountain of youth, and he would have guessed me in my early 30s.
Well, great. Well, since then, and your blood work has still been on the positive side, and still great.
And I still have not been on antibiotics, and I'm going on more than 6 months now.
Oh, excellent. Well, see, that I didn't even know. So that's actually great. I didn't know. I know it had been a while, but well, thank you. Thank you for coming in here. Again, this test is basically it's a food sensitivity test that is a type of allergy test, something a lot different than what you would come to expect when you have a food reaction to it. A lot of people expect, you have a rash from something that you're taking, or you have a swelling of some sort. This is not that kind of test. And so for the most part, I appreciate Monica for coming in, taking advantage of our service. And if you have any questions about it, by all means, give our office a call. We're here to help. And you can definitely schedule a consultation with me. And from there, we will go from there. So thank you very much. And Monica, thank you very much for coming in today. Appreciate it.
Thank you for doing it.